Spinal stenosis. Overview. A healthy spine and vertebrae provide enough space for your spinal cord and nerve roots. What is spinal stenosis? Spinal stenosis is the narrowing of one or more spaces within your spinal canal. Your spinal canal is the tunnel that runs through each of the vertebrae in your spine. It contains your spinal cord. Less space within your spinal canal cramps your spinal cord and the nerves that branch off it, nerve roots. Spinal stenosis can affect anyone, but it's most common in people over the age of 50. The condition most commonly affects two areas of your spine. Lower back, lumbar spinal stenosis. Your lumbar spine consists of 5 bones, vertebrae, in your lower back. Your lumbar vertebrae, known as L1 to L5, are the largest of your entire spine. Neck, cervical spinal stenosis. Your cervical spine consists of 7 vertebrae in your neck. These vertebrae are labeled C1 to C7. Your middle back, thoracic spine, can also have spinal stenosis, but this is rare. How common is spinal stenosis? Spinal stenosis is fairly common. Degenerative spinal changes affect up to 95% of people by the age of 50. Spinal stenosis is one of those changes. For people over 65 undergoing spine surgery, lumbar spinal stenosis is the most common diagnosis. Symptoms and causes. What are the symptoms of spinal stenosis? Depending on where and how severe your spinal stenosis is, you might feel the following in your neck, back, arms, legs, hands or feet. Pain, numbness, tingling, weakness. Spinal stenosis usually develops slowly over time. For this reason, you may not have any symptoms for a while, even if it shows up on X-rays or other imaging tests. Symptoms of lumbar spinal stenosis. Symptoms of lumbar, low back, spinal stenosis include pain in your low back. This is pain that begins in your buttocks and extends down your leg. It may continue into your foot. A heavy feeling in your legs, which may lead to cramping in one or both legs. Numbness or tingling, pins and needles, in your buttocks, leg or foot. Pain that worsens when you stand for long periods of time, walk or walk downhill. Pain that lessens when you lean forward, walk uphill or sit. Symptoms of cervical spinal stenosis. You can feel symptoms of cervical spinal stenosis anywhere below the point of the nerve compression in your neck. Symptoms include neck pain, numbness or tingling in your arm, hand, leg or foot, weakness or clumsiness in your arm, hand, leg or foot, balance problems, decreased function in your hands, like having issues writing or buttoning shirts. What does spinal stenosis pain feel like? Pain from spinal stenosis can feel different from person to person. Some describe it as a dull ache or tenderness. Others describe it as an electric-like or burning sensation. The pain can come and go. What causes spinal stenosis? Spinal stenosis has several causes. Many different changes or injuries in your spine can cause a narrowing of your spinal canal. The causes are split into 2 main groups. Acquired, developing after birth. Congenital, from birth. Acquired causes of spinal stenosis. Acquired spinal stenosis means you develop it later in life, after birth, most commonly after the age of 50. These cases usually happen from an injury or changes in your spine that occur as you age, degenerative changes. Causes of acquired spinal stenosis include bone overgrowth. Osteoarthritis is the wear and tear condition that breaks down the cartilage in your joints, including your spine. Cartilage is the protective covering of joints. As your cartilage wears away, your bones begin to rub against each other. Bulging or herniated discs. Between each vertebra is a flat, round cushioning pad, vertebral disc, that acts as a shock absorber. As you age, the discs can dry out and flatten. Thickened ligaments. Ligaments are the fiber bands that hold your spine together. Arthritis can cause ligaments to thicken over time and bulge into your spinal canal. Spinal fractures and injuries, broken or dislocated bones in your vertebrae or near your spine can narrow your canal space. Inflammation from injuries near your spine can also cause issues. Spinal cysts or tumors, growths within your spinal cord or between your spinal cord and vertebrae can narrow your spinal canal. Congenital causes of spinal stenosis. Congenital spinal stenosis affects babies and children. Issues with spine formation during fetal development. Genetic, inherited, conditions that affect bone growth. These are due to genetic mutations, changes. Some congenital causes of spinal stenosis include achondroplasia, a bone growth disorder that results in dwarfism due to a genetic mutation. Spinal dysraphism, when the spine, spinal cord or nerve roots don't form properly during fetal development. Congenital kyphosis, when your child's spine curves outward more than it should. As a result, their upper back looks overly rounded. Congenital short pedicles, when your baby is born with vertebrae pedicles, the bony sides of the spinal canal, that are shorter in length. Osteopetrosis, a rare genetic condition that causes your child's bones to grow abnormally and become overly dense. Morquio syndrome, a rare genetic condition that affects your child's bones, spine and other body systems. Hereditary multiple exostosis, diaphysial-aclasis, a rare genetic condition that causes several small bone growths, protrusions. Diagnosis and tests. Spine X-ray. X-rays use a small amount of radiation and can show changes in bone structure. For example, they can show a loss of disc height or bone spurs. MRI, magnetic resonance imaging, MRI, uses radio waves and a powerful magnet to create cross-sectional images of your spine. CT scan or CT myelogram, a computed tomography, CT, scan is a combination of X-rays that creates cross-sectional images of your spine. Management and treatment. At-home care for spinal stenosis. At-home care may include applying heat. Heat usually is the better choice for osteoarthritis pain. Heat increases blood flow, which relaxes your muscles and relieves aching joints. Applying cold. If heat isn't easing your symptoms, try ice, like an ice pack, frozen gel pack or a frozen bag of peas. Exercising. Check with your healthcare provider first, but exercise can help relieve pain. It also strengthens your muscles to support your spine and improves your flexibility and balance. Oral medications, over-the-counter nonsteroidal anti-inflammatory medications, NSAIDs, can help relieve inflammation and provide pain relief from spinal stenosis. Be sure to talk with your provider to learn about the possible long-term problems of taking these medicines. Physical therapy. Physical therapists will work with you to develop a back-healthy exercise program to help you gain strength and improve your balance, flexibility and spine stability. Strengthening your back and abdominal muscles, your core, will make your spine more resilient. Steroid injections. Getting corticosteroid injections in the space around pinched spinal nerves may help reduce inflammation, pain and irritation.